the functional medicine. So I'll directly come to the presentation where I would like to show you what type of cases I'm doing currently and how the remissions are being happening. I hope everybody can see the slides.
Yes, we can. You can put it on slideshow.
So the name is FMCN in action. Why this name? Because even if I take my case or my family member case, we were all going to the conventional medical system in India for our different issues, but the issues are never been sorted out. Rather, they were suppressed. We get chance, we get remission for a time, we take the medicine, and then when we stop the medicine, it again reoccurs. So this gives me an idea that something is happening, that the things are not being solved at the root cause level. So the function medicine is a wonderful science which act on the root cause analysis and then helps you to eradicate the root cause. Then the other things automatically go away. You need not to do anything about it. So I did my training with the Vita One platform with Dr. Musa and Dr. Arzu Panjwani. Those people are instrumental in giving me the information about the root cause healing. Earlier, I was a student of Satyajit Das, who brought me to in this field. Prior, I was linked to Dr. Eric Berg when I was in USA and doing some work with him. So let me start away with the clinical focus and methodology. My clinical focuses are insulin resistance spectrum disorders. You know, there are so many. PCOS, metabolic infertility, gut dysfunction, dysbiosis, some autoimmune issues, cardiometabolic reversal. And my methodologies are the functional diagnosis and pathway mapping, therapeutic low carb intervention. This is very important because I strongly believe that carbs are redundant and we do not need the high amount of carby diets which are prevailing nowadays in our scenario. And then the micronutrient restoration. About my practice, primarily insulin resistance, type 1, type 2 diabetes, then LADA, hypertensions, some fertility and obesity issues, fatty livers. And recently, I have been doing some autoimmune cases for Hashimoto's, for my Myasthenia gravis, and I have a good, you can say, success in those issues. I have been treating some heart conditions, LVEF function heart failures. And for all these, I am using the functional medicine testing protocols to get the patients get off the medications and reverse their condition through diet. So I usually look the things through the functional medicine pathways, all the different pathways and the metabolic cycles in the body, and try to work on those pathways. Now, let me come to the first case. Actually, there are 4 cases today. I took 4 cases, so the time is short and the cases are, all the cases are wonderfully now reversed. The time is short, so I will be taking all the cases for 10 to 12 minutes. If somebody wants to go into the deeper of these cases, I have posted these cases on Twitter on my handle, so they can visit over there and they can watch it. So this case is from Apurva. She is an Indian citizen and now currently working in Germany. I did this case with my intern, Ashim. I think Ashim is also in this meeting. And this file is created by that girl. She was constantly searching for the remissions and she did this search on her own. All these 8 points are jotted by that girl. When she came to me, she knows that she has prediabetes, she has insulin resistance, the vitamin B12 and D levels were low, she has a mild fatty liver. Through the tests, she know she has a chronic gastritis for so many years, she has hiatus hernia, grade A esophagitis, as her physician in Germany told her. and she was having high triglyceride. And when she approached me, she has a file, she sent me a file, and she has all the bundle list of all the supplements which are helpful in treating all these 8 issues, but she don't know how to apply them. So this was, I felt very happy because it's a very rare chance where a person approaches you with so many elaborations about her, and she even knows how to treat it, by which supplement she is going to use, but she don't know the way of doing it. So for that I helped her. I helped her, and I brought her to a 3 month discipline to solve her pre-diabetes and insulin resistance. Basically, I put her on a low carbohydrate diet, and I brought her into ketogenic phase later on. This ketogenic phase helps to reduce the hepatic fat plus insulin resistance, and I gave her some supplements related to zinc, kerosene, related to broccoli sprouts to remit the gut barrier dysfunctions. Slowly and slowly, within the 90 days of time, the ketosis and the fat oxidation happened. The reduction, the inflammation is gone, and she was on a very targeted nutrition because I have not given her much choices. She was very dedicated to reverse all the disorders, so I have targeted the nutrition. I have given her the list of the groceries, and to make all the food from those groceries and do not get out of those. And you can see the outcomes. I have tabulated a chart for you. Initially, the A1C score, which was the glycated hemoglobin, was 6. So she was into diabetic zone. And after just 90 days, she is at 5.1. The HOMA-IR, which is the precursor of the insulin resistance, is 3.02 at that time, which reduces to 1.7. The triglycerides were 304, and the HDL was low. But at after 90 days, the TG decreases and the HDL increases. So the TG to HDL ratio also reduce. This directly shows that the insulin resistance is dropping. Vitamin D was very low at that time. So we gave her some supplements which were available in her country. So the vitamin D level also improved from 6 to 60 because the gut barrier functions dysfunctions were improved. So she was always having issues in her chest. She was always having congestion. The acid is coming up due to GERD. She has bloating, reflux, and she always have a constant fatigue, which shows that immune functions were compromised. They were dramatically reduced, and she felt wonderfully fine after 90 days. And what do we learn from this case is that metabolic syndrome doesn't come into a single bracket. It comes as a syndrome, so many things together. So one condition is rarely one condition. Number two is low carbohydrate diet is a powerful therapeutic tool when you could do it in a right way. Because I have seen people doing the low carb diet. They tell me that I'm on the low carb diet. When I get into the details with the people, so I come to know that they are on a very high carb diet, but they presume it to be a low carb diet. So to be on a low carb diet is an art. You need to practice it. Then the functional testing plus nutritional, this beat the symptom suppression basically. So this is the root cause healing. And the real cause healing is possible in 90 days when the root metabolic pathways are addressed. So in this case, we have addressed the Krebs cycle and all the other cycles which are into the participation and try to correct the things. So after she gone through the 90 days program, almost 90% remissions were there, but the pending was slight gastritis because her stomach acids were still low. So we need to improve her agni in the stomach, and to improve her agni in the stomach, I have again uh, guided her to take some Ayurveda. And now she is currently again signed up with me and my intern Ashim, and we are working on the last 10% remissions. and she has recorded a wonderful feedback with us. I would like to play over here.
So I think it's taking a little time. We can't hear anything, Dr. Arvind.
There is an issue, I think, at my end.
Okay. You can try resharing.
Yeah. In my PowerPoint slides, I am facing some issue.
What is the issue?
I think they are hanged up. They are not opening now. I need 2 minutes.
Sure, not a problem. Take your 2 minutes, not a problem. In the meantime, I want everyone to know that if in case you want to present a case, because I do know there are a lot many people who are making a difference, who have been using functional medicine in their practice and want to present a case just like Dr. Arvind, you can do so. You can contact me or Mamita and let us know, and we'll help you bring it at Inspire Hour. By the way, if anyone has any questions till now, can put it on the chat box. If you're unable to do so, Dr. Arvind,
Yeah.
do you want me to share this the screen?
Yeah, sure. Why not? You just share it from your end and you can play it.
Okay, otherwise your slides are okay? You'll be able to
Yeah.
play the remaining? Okay.
Everything is okay.
All right. Are you able to see the screen?
Yeah.
Just a minute. This was
So hello everyone. My name is Apurva and I'm 30 years old.
Is that audible?
Yeah, to me it is audible.
Yeah, okay.
First of all, I'm really fortunate to be sitting here and giving this review, which I've gone through with Dr. Arvind Sabharwal and also Ashim Thakur. It's been 3 months, almost 3 months since I've enrolled with them, and I'm also planning to continue another 3 months because of how positive the results I've seen with them. So basically, before 3 months, my life was entirely different. I had a complete ruckus lifestyle and a lot of health problems. I was pre-diabetic. I had insulin resistance and fatty liver because my lifestyle was very bad. And also along with that, I was living abroad, so I was away from my family and everything. So a lot of factors contributed to this, and main thing was also I had chronic gastritis along with 1 centimeter of hiatal hernia. So basically, all the problems that you could think of that can make your life miserable. I had all of it, and before that, for 6 years, I think I had this chronic gastritis, and I tried a lot of remedies. I went to the German doctors as well, and only got one solution that I need to keep taking antacids. But eventually, that kind of gave me a lot of side effects, and nothing was working basically. And I was at one rock bottom where I was clueless. And luckily, that's when I found Ashim, who also introduced me to Dr. Arvind Sabharwal. And right after two of our initial consultation, I kind of got that positive, motivation from them that something can be changed from my all list of like 10 or more problems that I had. It was 3 months back. It would be very difficult for me to believe that all this could have gone or reversed. And I made sure to ask them again and again, is this all reversible? Because I was in such a mindset that I thought nothing can be reversed of all the problems that I had. I'm just 30 years old, but I felt like, I don't know, 40 plus or something. Because of all the problems I had. So firstly, what I liked about this program was that I got the positivity, that I got the motivation that this can be firstly reversed, because I was at a stage that I thought nothing is possible now. So that really helped me, or that pushed me to take up this course with them. And I must say that within the 3 months, uh, you can also verify with my reports before and after, but all the numbers have come down. My pre-diabetes and insulin resistance, and also my fatty liver, um, and my chronic gastritis. The symptoms have reduced, but it's still a long way to another 3 months to go, and that's why I've signed up again for the course. But all the metabolic functions have really improved in this 3 months because of the um, all the care that they took along with this journey. All the questions that I had was answered, and they gave me the right supplements and right diet at the right time. And I think this really put show the progress in the report that you can see. And also along with that, they also made sure that I was following it, and I was also quite disciplined enough to follow each and every word that they were telling and not take it for granted. So that was the main thing. Like, it was a good coordination between the two of us. That's why the numbers you can see the numbers as it is. So yeah, I'm quite happy right now, and I feel like a 30-year-old and not a 45-year-old or something. So I'm really looking forward to working with you again for the next 3 months. And right now we just have minor changes to be made. I'm sure everything will be done within the next 3 months. So I'm really happy that I found you guys.
Yeah.
Thank you.
Thank you. Thank you. Thank you very much, Apurva, for this wonderful, nice feedback. Both of us are very happy in this progress, which is now with us on papers in form of the blood reports.
Yes.
So this was the feedback of that girl, and you can see when these issues are reverted, how one feels. AJ, can you again reshare my presentation, as I have an issue with my laptop? So it would be better if you share it and we can show from there.
Okay, so I shall be sharing the screen from my end then. Okay.
Yeah.
All right.
So
This is the next one.
Yeah, this is the next case. This case comes to me in, I think, last year, August or September. And she is a girl from Ludhiana, Punjab, and currently she is a student in Canada. So she was experiencing some issues with her periods, as from last 2-3 months there were some odds about it, and she was worried. And being an international student, there are not maximum medical facilities over there in Canada. So she rang me up through a common friend, and I checked her insurance, and I advised her few tests, so which she can go in Canada. And interestingly, we found the LH to FSH ratio at this level, and the ultrasound confirms the cyst in her ovaries, and she has increased her weight by around 13 kgs when she was in Canada. So the functional insight was very simple. In Canada, she was under high stress because she was managing the two things. Number one, she was doing her studies. Number two, she was doing a job. So constantly, early in the morning, she was going to college, and then from college to job, and from job to home, and she was getting a sleep of 5 to 6 hours a day and no time to make her meals. So all time she is at the Tim Hortons and eating all the crap and junk food. So this leads to the elevation of a hormone which is insulin because of the high carby nature diet, and developed the hyperinsulinemia, which ultimately leads to more androgen and ovarian dysfunction. So I immediately requested her to make her meals at home. So she promised me that on Sunday she is on vacation. She make all the 7 days meal and she will keep into the fridge. So we did the same because there was no other choice of fresh meals. So I discussed with him and we make a chart for the 7 days, all the meals, 30, 40 meals, and she made the meals with the help of her friend and she stored in the fridge. All the meals are very low in carbohydrate. So the when she shift to the low carb diet along with some supplements which helps in her ovarian functions, she improved her insulin sensitivity. I gave him some supplements from do ship her supplements from Vitamin only, like Optiliver, vitamin D plus K2, because the values in Canada were suboptimal. She was having a supplement in Canada. The vitamin D3 was 600 IU and K2 was low, so it's very very low dose. So I shipped her some supplements from here, and the response was phenomenal. So she restored her sensitivity with insulin. Normal LH by FHS signaling starts to begin. Regular ovulation happens. Her weight is lost by around 12 to 13 kg. And her gut was repaired. Vitamin D, other things, they all improved. Metabolism was reset. Hormones were balanced. The regular periods, they come. And she very happily shared that her skin becomes flawless. Earlier, she have so much issues with the skin, just like acne and dry skin. But as these things come over, everything improved. AJ, next slide, please. So, what do I learn? Because see, every case is unique, and we are students for our whole life. So each and every individual case is wonderful. You need to sit, you need to relax, you need to think about what happened, how it happened. And in this case, again, I have found that insulin resistance is the primary driver. And with the low carb, I would able to drop the insulin values, and the targeted supplements augmented the idea, and she did it with very disciplined, and I was constantly with her for these 90 days, and it brought us a very very good dramatic changes and long lasting results. Even now she is wonderfully fine and she is enjoying the same lifestyle. So AJ, could you please play the feedback?
Hi everyone, my name is Kulnoor and I'm 24 years of age. I'm an international student in Canada. About 2 to 3 months ago, I skipped on my periods, which was the time when I went to doctor to get my blood reports done, and I was diagnosed with the beginning of PCOD. Along with that, there were several other imbalances in my body. And blood reports values were some were low, some were high, so there were quite a few imbalances. That was the time when I contacted Dr. Sabharwal through one of my references for the diet. And I would take the time to appreciate his efforts, that he really took the time to study my keys in detail. He gave me proper guidance on not just the diet, but also what lifestyle changes to make, what to eat, what not to eat, about supplements. And he also shared a lot of knowledge with me about the regular diet and lifestyle changes that one has to make in order to be healthy. And by now it's been almost 2.5 months me being closely in his guidance, and I'm honestly very happy to share that I got my periods back naturally, and I've lost almost 10 kgs by now. And it has been a wonderful journey. He has been a wonderful doctor. He treats every patient, I believe, like his family, and it has been really nice journey. Thank you so much.
So this was the feedback about the PCOD case, and this third case, this is from my city. This patient Kamaldeep, his young elder brother, he is a colleague of one of my good friend, and he suffered with a cardiac crisis. In April 2025, he had a congested heart failure, and he has a triple vessel heart disease. And the primary drivers for these issues were the two. Number one was hypertension, and the number two is the type 2 diabetic mellitus, which is diabetes. So when he got the heart failure, the family took him to the Fortis hospital, and the BP was 63/82. And the LVEF function, which are the left ventricle ejaculation functions, which are very important in the screening of the heart issues, were very low at around 15%, and the chances of survival were very low. But the doctors did the wonderful job. They revived him, and despite his conditions, they are able to revive him to his heart is to around 25%. So from 15% to 25% was the LVF condition. But the percentage remains same. It do not improve further. And his BP was constantly low from June end. And he was feeling chronic fatigue, he was feeling energy crisis, and the main problem was his headache. There was daily around for 8 to 9 hours he feel the headaches due to the low this blood pressure issue. So the other things were along with were the diabetes and the hypertension, and he was taking some medications. He was taking gliclazide, I think, which is gliclazide is your sulfonylurea tablet, and he was also taking one tablet for its DPP4, sitagliptin, at that time. So I met him in person, and I sit with him for 2 hours. I explained the whole scenario with him that we need to first get off from the issues of this diabetes and hypertension, then the heart function we can revive. I gave him some magnesium, some other supplements for the health, heart health growth, and some supplements from Ayurveda domain, and worked initially on his insulin resistance. AJ, can you get the next slide, please? AJ, next slide, please. So Kamaldeep started with me on 15th of August, and I adopted a low carb nutrition plan with him with all the functional medicine strategies, and I totally changed his way of eating. I spent quite a lot of time with him at his home because he is from my city, and I used to go at his home, have my tea over there, and give him a good amount of time to, because I want to educate him. The issue with him is that his education level was very down about this, and he was constantly, after even the problem, he was onto the crab diet. So I told him that if you be on the same type of diet, that the issue will again come and the atherosclerosis will happen again, and you will be in the same sort of trouble. So he talked to me patiently and he adhered to some of my things, not 100%, but I think 80% he has adhered. And for the 90 days, after 90 days, when he went for an eco test to 40s, surprisingly, the results were changed from 25% to 55%. His cardiologist was amazed and he did his echo twice to confirm that whether it is true or not. He thought it is a malfunction of the machine. So this is a wonderful outcome, that how one, with the help of the functional medicine, can create an environment. So I have not treated the heart disease. I have just created the environment. I have just treated the other functions which were acting as a perturbation for the heart. So when those things got away, heart automatically heals on its own. So he shared his testimony also, but the testimony is in Punjabi. He's a core Punjabi Jat. And AJ can play on the next slide. Those people who are aware in Punjabi, they can understand. These slides are the BP. Yeah, these are wonderful. See the left hand side BP, the left picture, and see the right. The left hand side is 17.7 to 25 July readings. See the low and high blood pressures. See the sugars. These low and high blood pressures are in the July 2025, and these sugar values are with two medicines. Number one is gliclazide and number two is sitagliptin. And on the right hand side, you see again the BPs and sugar. Now the sugars are without any medication. And you can see they are into a homeostatic range, always below 140 in the morning. And the BP is improved to a lot. Now he's wonderfully fine. Now he's taking care of his fields. He's basically a kisan, a farmer, and he's doing his all course, all jobs on his own, and he's very happy now. We met last time, and all the things are going very fine for him. So AJ, could you please the video feedback? Yeah, this picture is your LVEF function. The upper one is 25% and the lower one is the 55% from 40s. Yeah.
ਮੇਰਾ ਨਾਮ ਕਮਲਦੀਪ ਹੈ, ਮੈਂ ਪਟਿਆਲੇ ਦਾ ਰਹਿਣ ਵਾਲਾ। ਮੇਰੀ ਹਾਰਟ ਅਟੈਕ ਮੈਨੂੰ ਹਾਰਟ ਅਟੈਕ ਆਇਆ ਸੀਗਾ। ਮੇਰੀ ਹਾਰਟ 15% ਰਹਿ ਗਈ ਸੀਗੀ ਹਾਰਟ ਫੰਕਸ਼ਨਿੰਗ। ਫਿਰ ਮੈਨੂੰ 26 ਤਰੀਕ ਨੂੰ ਮੈਨੂੰ ਮੈਕਸ ਵਿੱਚ ਦਾਖਲ ਕੀਤਾ ਗਿਆ। ਫਿਰ ਉੱਥੇ ਅਸੀਂ 4 ਦਿਨ ਟਰੀਟਮੈਂਟ ਕਰਨ ਤੋਂ ਬਾਅਦ ਫਿਰ ਮੇਰਾ ਹਾਰਟ 19% ਹੋ ਗਿਆ, 15 ਤੋਂ 19 ਹੋ ਗਿਆ। ਅਤੇ ਫਿਰ ਅਸੀਂ ਸਾਡੀ ਛੁੱਟੀ ਹੋ ਗਈ। ਫਿਰ ਅਸੀਂ ਆ ਕੇ ਪਟਿਆਲੇ ਆ ਗਏ। ਪਟਿਆਲੇ ਆ ਕੇ ਅਸੀਂ ਡਾਕਟਰ ਅਰਵਿੰਦ ਸਭਰਵਾਲ ਨੂੰ ਮਿਲੇ। ਇਹਨਾਂ ਨੇ ਫਿਰ ਸਾਨੂੰ ਫੂਡ ਸਪਲੀਮੈਂਟ ਦਿੱਤੇ, ਜਿਹਦੇ ਨਾਲ ਖਾਣ ਨਾਲ ਵੀ ਮੇਰਾ ਹੁਣ ਸਾਰਾ ਕੁਝ ਅੱਛਾ ਹੋ ਗਿਆ। ਮੈਨੂੰ ਮੇਰੀ ਹਾਰਟ ਫੰਕਸ਼ਨਿੰਗ 55% ਹੋ ਗਈ ਹੈ। ਮੇਰੀ ਹਾਰਟ ਦੀ ਹੁਣ ਬਹੁਤ ਅੱਛੀ ਹੋ ਗਿਆ ਹੈ, ਜਿਹਦੇ ਨਾਲ ਵੀ ਹੁਣ ਮੈਨੂੰ ਕੋਈ ਮਹਿਸੂਸ ਨਹੀਂ ਹੁੰਦਾ। ਬਿਲਕੁਲ ਮੈਂ ਠੀਕ ਹਾਂ ਹੁਣ। ਮੇਰਾ ਸਭ ਕੁਝ ਓਕੇ ਹੈ ਹੁਣ।
So he's saying मेरा ਹੁਣ सब कुछ okay है। मेरा ਹੁਣ सब कुछ okay means now I am perfectly fine and doing all the course of my life. And I want to say that whole family was in so much of a depression that what will happen to our kid, that he has gone through such a massive heart attack, and they were having no hope of survival. They thought that he will remain on the bed till his last breath. But this is the magic of the functional medicine, which you are witnessing right now. Even I am witnessing. AJ, please, next slide. Yeah, this case is very close to me. This is a case of reversal journey in ocular myasthenia gravis, which is an autoimmune disorder. And I took this case in the month of, I took this case on, I think, 1st of February. I took this case. We started on 1st of February. I took this case on 25th of January. And 5 days I took for the protocol. And from 1st of February, she started. She's a girl. Basically, she hails from, I think, Bhubaneswar. Currently, she is in Bombay or maybe in Hyderabad, I don't remember. She is Samiksha, and she has a issue which is ocular mesenteric gravis, which is autoimmune neuromuscular disorder. In this type of issue, the eyelid droops, totus, and she has double vision. Eye muscles were fatigued, and she has very low stamina, and also have an emotional issue due to the cosmetic and the functional impact in the society because she's a working woman. Next slide, please. So, what is this issue? And I have noted in the first paragraph, the autoantibodies target the acetylcholine receptors at the neuromuscular joint, especially affecting the extraocular muscles. This is the issue with this disease, and the core challenges are unilateral. This is one eye, or the bilateral ptosis, which is the drooping of eye. The vision disturbances impacting the daily functions, rapid fatigability of eye muscles, dependence on the symptomatic medication, fear of progression to generalized mesenteria gravis, which can go to the complete body. Psychological impacts are there: low confidence, anxiety, social engagement was reduced, and the key challenge was not to mere symptomatic relief, but immune modulation, neuromuscular stabilization, and prevention of these disease progression. Because when she met me, she was on zero hopes. She told me that I have come to you because of my friend has referred, but I have zero hopes because I have gone to so many doctors, so many hospitals. Everybody is treating me with the same two things. Number one is Visalone, which is a steroid. Number two is Graviator 60. Graviator 60 is a medication which gives the acetylcholine, which helps to make the coordination of the mind with the muscular joints. So she told me that every doctor has the same type of issue. I I talked to her on Zoom meeting. I told her that I'm not going to give you any medication. I'm just going to change your food. And as per your blood reports, which we did, I'm going to just make your body full of those minerals which are now depleting and depleting due to some of the other reasons. So that is what I'm going to do, nothing else. And rest, you see, ultimately you need to go to the Almighty. So I am a God-fearing person and I believe him. So rest is on to him. So we started the protocol on 20th of February. In the next slide, you will go through the details also. So AJ, please, next slides. So these are the identified underlying drivers, which are the immune dysregulation, chronic systematic inflammation, mitochondrial fatigue. These are my studies on her blood reports. You can all read all these drivers, and I made a protocol for her to work out for first 90 days, and then we can modulate that protocol. AJ, next slide, please. So these are the issues which were on my mind: anti-inflammatory nutrition protocol, gut immune axis optimization, mitochondrial and neuromuscular supports, stress and recovery modulation, gradual functioning conditioning, which are the exercises of eyes. And the outcome is wonderful. In just 20 days, we have tested her antibodies again the last day. Earlier, the antibodies were more than 8. Now the result has come that antibodies are less than 6. So more than 20-25% reduction is there in just 20 days. She is not taking any medication which she was taking, nor she is taking Visalone steroid, nor she is taking the Graviator 60, which is very important in this disease. She don't have any redness in the eyes, no drooping of the eyes. Her energy levels are enhanced. She has restored a very confidence now that she can be treated. Earlier, she was hopeless, and she has reduced all the dependency on the supports. So wonderful, wonderful changes happened in just 20 days. I'm hoping this is a very new case, and I'm hoping even I am treating this type of autoimmune disease for the first time in my life. So I'm hoping a wonderful and complete remission in coming time. Let's see how the things goes on. But she sent me a very nice video last night, which I have incorporated in this slide as well. So AJ, could you please start it?
Hi, my name is Samiksha. I'm here to share my experience. So first I'll tell you what happened to me. Actually last year I got diagnosis with some health problem. During that time, like my eyes, I'm talking about my left side eyes, like my eyes got completely red, swelled, and it got drooped completely, and it means you can say that it's a ptosis, it means I had a ptosis, and it was completely blur. So then I went to the doctor, and they like initially they could not find like what's the problem. They thought maybe it's related with the sinus, and they started treating me on that, but still they could not find anything. So then I went through so many MRI, like MRI as in my brain, my optical nerves, my face, everything. Like I did so many MRI, but still they could not find what's the reason, what is the exact cause behind this. Meanwhile, my health condition got worse, and I got partially paralyzed. Then I consulted many doctor, went through so many treatment. Eventually I got to know that, like, yes, I have a disease, rare disease called myasthenia gravis. That is an autoimmune disease. And then the doctors gave me some medicines and steroid, as in myasthenia have no such particular treatment, so initially they have to go with the steroid. So as a result, I put on so much weight, and I went to the medicines, and they told me this medicine I need to continue for a lifetime. So I continue with that medicines. Meanwhile, one of my friend, she recommended me Dr. Arvind. So she told me, why don't you check with him like once, maybe you will get a result. So honestly, when she told me, I had zero expectations, because I know the condition and nothing going to happen, because it's been a long time I'm continuing with that medicine. Nothing going to happen, but still thought, let's just try. So I discussed with Dr. Arvind with all this scenario, all this thing, and he confidently told me, we are going to treat these things, we'll try to treat these things naturally. But honestly, I was in a pretty dilemma. At first I was dilemma, like I know the was the condition, it is very difficult to reverse back this thing, but I'm happy to share with you that yes, it's just been 20 days only, and I reduced my weight. He guided me with supplements, good supplements and diet, majorly food, my diet, what I should have, what should not have, and my what food if I'll have, my T cell got reduced. He explained me each and everything, and as I told you, and it's just been 20 days. Even I had some deficiencies as well, like vitamin B, B12 and D3, iron, hemoglobin. I had all these things, I had deficiencies. Slowly he treated me all these things. Now recently even I test my antibody test. Earlier it was like more than 8, but now it's less than 6, and my deficiencies even now it's up to the level. I'm happy that, and the good part is, as I told you, like I reduce naturally. I'm reduced almost like a 6 kilo right now, and I'm not taking any medicine. This is the best part. This myasthenia gravis medicine, even I had thyroid, so even I tested that one, it got normal, and I'm so happy, like within 20 days only I'm like everything is I'm in the treating position, like I'm going in the right direction. So thank you so much. It is thank you so much. Really, thank you so much, Dr. Arvind. It is way far difficult to reverse back this autoimmune disease, but you did that. We are doing that. So means even some, I'm telling you one thing, like sometimes I forget to share my daily update, like daily status, but he never forget to ask me what is the like update, what is the progress, like how much it's like your bp, how much your weight right now, how, are you taking these medicines or not. It's like a completely guidance, like every day you are guiding me properly. So that is the reason I'm not taking any medicines, that my autoimmune medicines. So I'm happy right now. Thank you so much, sir. And although initially I was doubtful, but now I don't have, I know that it's a long way to go right now, but I'm happy that I'm in the right track, I'm in the right direction. So thank you so much, Dr. Arvind, and from my bottom of my heart. And I'm expecting next time, if when I'm going to share my story, I will have a better things to share and a better way like to express what are the progress I have. So thank you so much.
So you can see.
I am just stopping the share. I just want to see the reactions from the people. I mean, at least I couldn't hold it. I was like, this is mind blowing. This is mind blowing, Dr. Arvind. I have no words. Seriously,
See,
no words. I want to see some reactions from the people. What is it? The kind of guts with which you have put in, the kind of confidence that you gave, the kind of boost, the mental boost that you have given to the patients, it's visible, Dr. Arvind. It's visible. I could see your patients just like you. They have incorporated, they have imbibed that confidence from you. And it's so clear the kind of association that you keep, the partnership that you keep. You know, this is true partnership. I want everyone to witness this. It's not about cases, it's about the endless number of hours and days, the real heart that Dr. Arvind is putting in to make all of these things. It is work. 2 hours just talking, doing a regular follow up. This is true partnership. Everyone, this is true partnership. This is what you need to understand. This is the power of functional medicine. When I can see miracle written on the chat box, this is why miracles happen, because there is work behind it. And it's not work only from the patient, it's work also from the practitioner. Both of them are working together to achieve something which is achievable. And I want to highlight an important thing. The person is without any hope, absolutely hopeless. When you have a hopeless person, you yourself lose hope that I can do something with this person. This person's mental state is only not okay. How can I help this person? But look at the audacity with which Dr. Arvind has gone to this person. That is something that I would definitely tell everyone. You have to learn it. That is what makes the difference. You need to be brave. You need to take the plunge. You need to trust what you have studied, what you have learned. You need to create those connections, interconnections. What can work? Let's give it a try. We need to see it. So I want to say absolutely amazing. I'm mind blown. This is an incredible work done. More power to you, Dr. Arvind. I would love to see such four powerful cases. I don't know. I don't even see this in power hours. It's like four powerful cases within an hour. Mind blowing. What a beautiful morning today. I wanted to just stop and say this because I was really, really waiting to see this. So please show some reactions. Dear people, I'm really looking in for what is the kind of love that you would like to give to Dr. Arvind. And Dr. Arvind, I want you to see everyone's appreciation. I have switched off the mute button for everyone. But yes, thank you so much. Ashim, you're also there. I would love to bring you on stage, by the way, Ashim, if you can switch on your video, Ashim. If you can switch on your video, I can bring you on stage. Okay. All right. Ashim, take your time. I would love to bring you on stage. We will meet you. The presentation is not as yet over. I just wanted to say, yes, this is fabulous, fantastic. I definitely had tears in my eyes looking at all the cases. It is the smile on their faces say a million, zillion words. I really don't know what to say. The kind of satisfaction, amazing. Hats off to you, sir. I'm just going to get back to the screen. Okay.
Yeah. So this is all about the things which I want to say, the confidence, about the clarity, about the client communication, which transition from symptom-based prescribing to pathway interventions, understanding the metabolic pathways. It may be gut issues, maybe H. pylori, maybe GERD, maybe insulin resistance, maybe the other, which are the central drivers. So we need to map the pathways, we need to remove the triggers, we need to restore the nutrients, we need to correct the metabolism. And the magic always happens because nutrition is power. So there's a fight between the system suppression to the metabolic correction. So in functional medicine, we have been taught about the fight, how to do the metabolic correction rather to do the system suppressions. So this is a wonderful, wonderful journey which I am doing with my teachers, and I'm hoping to help the other teachers, other people as well. Here I am presenting 4 cases. Currently, in last 6 months, I think I've been able to help around 70 odd people with different type of issues. So if someday I get a chance from the Vita One platform, I would like to share the stories as well. So Dr. AJ, can you just turn over the slide? Yeah, this is all I want to say in few words, that how this functional medicine and the clinical nutrition helps you. So it look beyond the reports. It identify the metabolic markers, because these are words from heart. It connect the system instead of treating the organs in isolation, which is being done in the this conventional medicine domain. It addressed the gut dysfunction, addressed the insulin resistance, immune imbalances, and other things. And from disease management, it goes to the disease reversal. So be prepared. Those people who are just into the functional medicine, so be prepared to unlearn, because the most important thing is to unlearn and then to relearn, because you are going to unlearn first, then you are going to relearn, because it's common, and the common practice is कि हमारे बड़े ये कहते थे, पंजाबी च कहंदे जी ਉਹ ਕਹਿੰਦੇ ਸੀ. ਸੋ ਮੈਂ ਕਈ ਵਾਰੀ ਲੱਭਦਾ ਹੁੰਨਾ ਉਹ ਕਿਹੜੇ ਸੀ ਜਿਹੜੇ ਕਹਿੰਦੇ ਸੀ. So you never know कि ਉਹ ਕਹਿੰਦੇ ਸੀ ਕੌਣ ਹੈ, because there is no scientific evidence behind that. So you need to guide your patients, you need to take the responsibility, you need to make a connection. Every individual is your family member. Just like your family member, love the patient and try to do the best what you can do. So in the last, I think I have a thanks slide. So AJ, I would like to thank the Vita One platform. I would like to thank my teachers, especially Dr. Berg, then Satyajit Das from Gurgaon, Dr. Anis Musa for his visionary leadership, Dr. Arzu Panjwani for the clinical sharpness, Rashi Mathur for her coordination, guidance, to AJ for her enthusiasm, and to everyone, entire back team, which sometimes is not on the spotlight, but is always helping you. Many people like Shaista, like Momita and other, they are at the back end and working constantly day and night for the help of the practitioner and the patients. I would like to thank all of you from the core of my heart. Thank you very much.
Incredible stuff there. Beautifully done. Richa, you're saying great work. How can we connect with you? Dr. Arvind is the FMCN alumni. If you're an alumni, you'll meet him in the alumni group. And if you're in a current student group, you can complete your FMCN course and you will get to meet him. So yes, Pramila, I totally agree with you. Difficult cases, commitment. Yes. What he said in the end, love your patients. I would also say that there was this therapy that you gave, the care and the love that you showed to the patient was a supplement that made one of the major differences. We can't see it, but we can definitely feel it. I'm pretty sure all of us felt it in all of those videos. What an amazing what amazing work there. I am just going to go. I think there were a
AJ,
couple of questions. Yeah,
AJ, can you bring Ashim and Satyajit sir to the screen?
I will. Ashim, if you're ready, I can bring you on the screen. You can switch on your video, and yeah, he's there. Ashim, just give me a minute. I will also make you. Yeah, you can unmute yourself. And if Satyajit is there, just give me a minute. Let me check. Satyajit, I'm bringing you on screen. Okay. Great. Oh my God. Oh my God. Great. Fantastic to see you, Ashim. What an incredible job you guys are doing. Satyajit, we always see you speaking quite a lot on the alumni group as well. What miracles you guys are doing. Next time, I would definitely love to see you coming up and showcasing the work. What amazing jobs these people are doing. And there are a lot of people, by the way, I would say many people don't like to come in the forefront, but trust us, we'll love it. We need to see your work. That's how changes happen. Yeah, starting up with Satyajit. So your name was first, Satyajit, when Dr. Arvind mentioned, with all the things that you have seen today, I would love to know what is it that's going through your mind at this point, and of course, what is it that you would advise to everyone going forward?
Nothing. The passion he brings to everything he does, actually. Every case he takes, like, so passionate. He goes into like Ajay mentioned, he consider every case as his own family member. And the kind of follow-up he does, the kind of interaction, not only with that particular case, but then for that case, he has discussed many times with me. I'm sure he must be discussing with a lot of other people in the FMCN group. And he takes it to that level, the maximum level where, and his results are speaking for themselves. Yeah, the passion, that's amazing.
Yeah, I definitely want to add on. He's always very thrilled about presenting. He loves the happiness that comes in his patients, and he wants to show it to the world. That is when the other person makes you feel happy, that makes I mean that, you have no words to explain what is that thing, but that thing definitely makes a massive difference. Ashim, you are the person who has been working on behind the scenes, I would say, at least for us. How is it? I could see that you had written quite a lot. I want you to speak it out. And of course, I also want to know how things have been with Dr. Arvind.
Okay, so first of all, I'm a nobody. I got introduced to the world of nutrition through Mr. Satyajit Dash, and both of these gentlemen are my mentors. I'm nothing but a student over here. I have been in contact with Satyajit sir for more than like 1.5 years now, and Dr. Arvind, I have been working with him for quite a few months now. I mean, this journey has been amazing. It has transformed me in so many other ways, not just nutrition. You know, the work they both put into these their cases, and the results speak for themselves, obviously. But when we're working behind the scenes, I mean, they do a lot of research. They're probably discussing with some other industry leader, some other industry expert, with doctors as well. And that has taught me as well, you know, to get to the root causes of the cases. I mean, when we first get a report, I mean, we need to decipher what it is telling us. I mean, so that was something which was quite overwhelming to me. But then now I'm starting to piece that puzzle together. And yeah, I'm nothing but a student. I I dived into nutrition because of my own health illnesses. So I think that can be a story for some time later. But yeah, I'll let these two
There will be
gentlemen.
so many people. I'm pretty sure all the people who have joined in, they have their own stories, either their loved ones, they themselves, or someone or the other. It always starts from there. We always get one chatka and then we go ahead and do stuff. So brilliant. Yes, Ashim, you wanted to say something more.
I want to add one
Yeah.
more thing for the larger audience. How many
Yeah.
of you know this gentleman, Dr. Arvind Sabharwal, is a nuclear physics scientist? He's a
Yes, and
professor in
everyone
nuclear
is
physics.
this is thank you for putting this across, because yes, this was a big hue and cry even in the group, and everyone is going to look in for nuclear physics. Are you going to teach that, Dr. Arvind? We're gonna have topics on nuclear physics and everything. But yes, um, that's that's the art of learning physiology. When you learn, everyone has the right to
I
learn.
want to add
Yep.
something here. So you see, I started my physics was my first love. I was throughout scholar and I did my PhD from IIT Roorkee. So physics is always been a passion for me. And during doing the research, I was so addicted to going through the research papers. And now the change has been done. Instead of now going through the physics paper, I am more on the PubMed now. So instead of going through the physics paper, now I am more into the metabolic paper, nutrition science, and other. The passion is the same. The domain has been shifted to a little. Now many people don't know me as a physics professor, they know me as a metabolic coach. So the whole see, I started very long in 2014 with Dr. Berg, but this man Satyajit Das, he's a matchstick. He put fire in me, and then the things are now the things are unstoppable. So he is the man behind my success, behind the all these things which is happening. He's my first guru in India. So
Excellent, excellent.
yeah,
And
I
that
want to
matchstick
add.
analogy that you've put in, everyone is actually a guru.
Yeah,
So you can always light someone's fire. Remember, you have it. Be like a diya, be like a candle, be like that
yeah.
matchstick, and you
So
can ignite that flame. That's
AJ,
true.
AJ, I want to also conclude it. ਸਾਡੇ ਨਾ ਪੰਜਾਬੀ ਚ ਕਹਿੰਦੇ ਆ ਕਾਣੇ ਨੂੰ ਕਾਣਾ ਨਾ ਆਖੀਏ ਉਹਦਾ ਅੰਦਰ ਲਈਏ ਰੱਖ ਉਹਨੂੰ ਕੋਲ ਬੁਲਾ ਕੇ ਪੁੱਛੀਏ ਕਾਕਾ ਤੇਰੀ ਕੀਕਣ ਬੈਠੀ ਅੱਖ. So meaning is कि whenever a person approach you with the difficulties, always try to put arms around him, always give him warmth, always give hope, because hope sustain lives. Never discourage, never do body shaming, never do all these stupid type of things. So people do, I know on social media, even I say the first thing is love. Love makes you 50% healthier, and the other things then comes by. So each and everything is treatable. There are books by so many people that with the mineral, if you correct the minerals, each and every deficiency and every disease can be cured. So we need to get onto that instead of the contemporary medical system. We need to get onto the net, close to the nature. Everything is sortable. Thank you.
Love is a common language, and I'm pretty sure all of us, we don't even see, whether you're a doctor, nutritionist, or what. You have a heart, everyone's got a heart. Everyone's got a body. Everyone's got physiology. Why are you even thinking that you don't need to do that? You have to. So, what a fantastic, I'm telling you, it's been a mind blowing morning for me. I'm pretty sure it's been mind blowing for everyone else as well. And yes, I would love to know if Ashim has joined us for FMCN as well. If not, but you definitely should join in. And there are going to be multiple stories like these. So just like Satyajit, yes, Satyajit, I would want you to be in the next Inspire. I want to know, by the way, on the chat box, do you want to listen to Satyajit? I want to know on the chat box, how many of you want to see cases from Satyajit? How many of you? Me, I can see some thumbs up coming in. Ashim is also saying there. Richa, of course, is coming. You're next. So
Sure,
Satyajit,
sure.
you are
Very soon, very
next.
soon.
I would love to see you in our next month's Inspire Hour. Keep inspiring everyone. Everyone has that light. Do light that candles to each other. That's why we are a community. That is why this community is for life. And I want more people to come in. You all are making a difference. It's just that it's just not visible. It's just that sometimes we just hesitate to show things. Oh, I don't feel like, but you know what? Love is a general human, common human language. Everyone has been there, done that, seen it. Everyone understands it. So
Another very
wonderful
unique
stuff.
thing I would like to tell about Dr. Arvind.
Uh-huh.
Sometimes it becomes very difficult for we as a coach to ask for a video testimonial. But I don't know, Dr. Arvind's clients happily give him the video testimonial.
ये तो जानना पड़ेगा. Dr. Arvind, what is the secret behind this? And they give it with all the, I mean, they really
Family.
look good also.
एक ही reason है, family.
Yeah,
I never treat them outside. They are
beautiful,
one of my own.
beautiful, beautiful.
I can spend a night for them. I can spend a good amount of time for them. I can be on calls for 2 hours. I can be with them. Whenever I go to outstation, I put a message in my group. I am coming to this place. How many are available? And I especially drive to their homes. Recently, I went to Ghaziabad. I'm doing a CKD reversal case. It's an autosomal kidney issue. And that guy is a high court lawyer. And his kidney is was 7.5 was the value of creatinine. Now he came to 4.5. So his kidney is remitted, and his family is connected to Shatrughan Sinha, and he is, I think, brother of the Swar Kokila from this area, Patna, I think, Bihar. So she is a Bollywood singer. Her son is also joined me for the diabetic remission. So we clicked so many pictures. We enjoyed a supper. So it's always being a treat. Whenever I go to Gurgaon, I always ping Satyajit sir. I am coming, but he remained too busy. So it's all. I am always ready. Work is later. For me, human love is first. Love is
I
second.
would like to share one incident I remember about Arvind sir's work ethic. So he was dealing with this patient who was type 2 diabetic, or I think type 1 diabetic. She injected a high dose of insulin, and her blood sugar dropped to like 40s or 30s. And it was 1 a.m. in the night, and he still replied to her, and he remained up until 6 a.m. in the morning until her blood sugar stabilized, and then he went back to sleep.
That's up.
Family. Family. This is family. Amazing, amazing example you're setting up, Dr. Arvind. More power to you. You are definitely making us feel what's the power of community, what's the power of family, what's the power of giving love. No doubt about it. Everything else, of course, your power of that nuclear physics and everything has come into play even in this. All that, the way you dig in things, the way you like to find out stuff right from within a person, as you very nicely explained the Punjabi saying, you are there looking deep within. You don't even care about what is coming out outside. I know this is there. Okay, what's within? I'm going to search. Hats off, no doubt about it. It's been a fantastic day. But yes, everything also needs to come to an end. That's why I'll have to close this Inspire Hour as well. But yes, I'm pretty sure for everyone, it's been super inspirational. What a powerful Inspire Hour. Next time, we're going to see Satyajit next month, pretty soon, with his cases. And of course, with that, we're going to start up a huge line with all of you. Thank you so much once again. Thank you so much, Dr. Arvind. It's been an awesome pleasure to host you. Nice to see you. Ashim, keep doing the wonderful work you're doing. And Satyajit, you're rocking. No problem at all. Nothing more to say. But yes, and everyone else, you are doing an amazing job. I would love to see your work, not me. The world needs to know what is the power of functional medicine. It's been great. Have a wonderful, wonderful, inspirational rest of the month till we're going to meet Satyajit in the next one. Thank you so much. Bye bye. That's me, Coach AJ, signing off. Bye bye.